Hello, I'm Natalie Kunsman, MD, and my expertise is in the merging of the Eastern philosophies of health and wellness with the Western principles. I'm an MD in family medicine, and I take an integrative, holistic approach to health and healing. I get a lot of questions about energy medicine and what exactly that is. So today that will be our topic of discussion. Energy medicine is actually either a diagnostic or therapeutic use of anything from heat, light, sound, gravity, pressure, magnetism, chemical energy, electromagnetic energy, and anything that has a force that can interpenetrate us. Energy medicine includes a whole bunch of hands-on methods, energy techniques, and even some devices that are essentially using frequencies, intensities, wave shapes, and anything that can stimulate to help repair tissue in the human body. So this is a little bit different than some of the other facets of medicine, which may include medications, surgeries, spiritual, psychological, or nutrition therapies. The forms that I would like to focus on are those that do actually bridge the Eastern and Western philosophies, such that we can create a holistic package for individual healing. And Asians have taught this for a long period of time, that the human body is actually vibrational and lives within and is a biofield in and of itself, and that energy biofield needs to stay healthy and well for our human body to exist in a good wellness capacity. And I remind my patients that we already know this from the Western portion of medicine and the traditional approaches, such that we already know about EKGs, which are measuring electrocardiac potential, EEGs, which are measuring electroencephalograms, and EMGs, which are measuring electrical muscle potential. And there's even more subtle energy fields that are being discovered, such that scientists are starting to discover that there are actually biophoton emissions, which are little particles of light that are being videographed at the DNA level, and they are literally light photons that we can see with the appropriate technology. So back to energy. There are two types of waves. We have the mechanical waves and we have EMF waves. Mechanical waves are those that can occur in a solid, a gas, or a liquid, and they can be described based upon how fast or how slow they move. For instance, an ocean wave is quite slow. There are other mechanical waves such as seismic waves, Schumann resonance, sound waves, etc. The other waveforms are EMF waveforms, and those are waves that do not need a medium, a gas, a solid, or liquid to be moving, and they can actually move in a vacuum or what we would view as an electric field. Heinrich Hertz actually discovered these as well, and we also describe them based upon how fast or how slow they are moving. So from slow to fast, we have the radio waves, the microwaves, the infrared, the visible wavelength, then off to the faster ones, which are X-rays, which are about the size of atoms, and the gamma rays, which are about the size of atomic nuclei. And of course, the smaller the waveform gets, the faster it moves. And then as a byproduct, or sometimes the desired effect for the treatment, there is a heat that's generated from the vibration of the waves in EMF. So I thought maybe we would be finished with the scientific end of the waveforms and get into the uses of energy medicine in our human body healing. So there are diagnostic uses of energy medicine, and as a reminder, we have the energetic fields that our bodies live in, and we are continually vibrating, and we are transforming waveforms. And I'll give one example which may make sense, which is sound. So we have waves that are traveling in air that will get to our tympanic membranes, will oscillate bones, which will get to the round window and create some water dynamics, which will ultimately create an electrical current in the brain to the brainstem for us to interpret sound. And we have other water dynamics in our organs and digestive tracts, and we have bone oscillation, and we also have EMF, for instance, that will hit our retina and create electrical fields. And now, as previously mentioned, we have both biophotons of light. Diagnostically, we can use MRIs, which are magnetic resonance imaging. So the changing in magnetic fields will vibrate to the fluid dynamics in our bodies and organs and generate pictures. Also, we have ultrasound technology, which will use mechanical waveforms of high frequency sound to penetrate the body by using a probe. And that machine will calculate how fast those waves go back and forth from the tissue to the probe, and it will also generate pictures. I think a lot of us know that it is used for fetal ultrasounds, cardiac pictures, and actually an organ assessment. We have X-rays, which is also a form of EMF energy, which are very fast waves that will vibrate and penetrate the soft tissue and typically stop at the bony structures and create pictures and create what we classically know as X-rays to help us diagnose broken bones. A CAT scan is actually many of these X-ray beams for a longer period of time, which gets taken to a computer, calculated, and the emissions will create a much finer detailed picture. So those were most of the diagnostic ones that are quite familiar and readily used today in medicine. So now we're going to go off to the fun stuff, which is healing with energy medicine. And I've brought some things that are in my house that I use quite often for some of my healing practices. And I thought I would also let you know that I have expertise in sound therapy, which is a little bit different than music therapy, although music therapy is a portion of sound healing. Our bodies are actually wired to be sensitive to sound, and some of those previously mentioned techniques that I talked about were using infrasonic and ultrasonic measures. But now we're trying to use a little bit more of the sound and vibro acoustics in the hearing range. There are sound generators such as tuning forks. I think we all know what a tuning fork is, but tuning forks and tuning bowls and singing itself, which are used to vibrate human tissue and are often used currently in anxiety, and we try to attune, balance, and calm the body. Now, ultrasound waves is used quite frequently in the physical therapy arena for phonophoresis. And phonophoresis is the application of a topical cream that may be an anti-inflammatory with the ultrasound technology to penetrate such that the anti-inflammatory cream will get through the tissue better. And obviously it does a little bit better of a job for reducing swelling, reducing pain, and there are sometimes it helps promote fracture healing. Now you could take that same ultrasound technology and you can merge MRI technology with it, and now you can destroy fibroids, you can work on breast tumor reduction, and you can remove prostate tumors. For any of those who have had a kidney stone, we can also use ultrasound therapy for something that's called lithotripsy, which is the ultrasound technology breaking up the kidney stone so that the body can pass it more readily. We also, and I, use music and vibroacoustic therapy. And there are origins of this mostly in the psychological field initially, such that it was used for PTSD in World War II and currently used for anxiety and autism. Now, there are more studies that are needed to satisfy those in the Western delivery of healthcare, but there is a lot of work being done in the non-traditional healers using sound to balance the body. Now, even biologists and voice teachers both would agree that the human body is a resonating cavity, and that is what makes the qualities of our sound different from other people, and also the resonating cavity is what we would change or modify to change our sound. Besides some of the psychological applications for sound and bioacoustic therapy, there is a lot of work being done, and of course this is merging Eastern and Western philosophies together, that we are working on chakra balancing. Now, chakras, there are purportedly 7 of those in the human body, which are bioenergy fields. And within those fields, there are certain organs in that area that have their own resonant frequencies that they vibrate. And there is a lot of work being done on how to attune or entrain those frequencies of the organs to create a new emerging treatment for wellness. Again, we talked a little bit about binaural beats in the past, and there are ways to create the binaural phenomenon such that we can entrain our brain chemistry to use alpha, delta, theta, and beta waves to quiet down seizure activities, to quiet down tremors, to aid in depression and anxiety, and create a much more balanced brain chemistry. I'd like to talk a little bit about pulsating EMF, and I have a device here. I couldn't bring the whole mat that I use, so I brought a portion of it, and they can be used with amethyst crystals, or the one that I have is copper coil that will generate electrical frequencies to help align and entrain the body, the nervous system, and the brain. And this was used about 40 years ago, starting with the Russian Olympians. And they had the most data regarding this from its inception. And they used it for post-workout to help with muscle and tissue recovery. And it is used quite heavily in equine horse racing to help with their post-running recoveries as well. It is currently being evaluated to cut inflammation, promote wound healing, and heavily used for sleep disorders. And I have one in my house. I use it very often, and it helps overall wellness, promotes sleep, and help with sore areas of muscles that has happened after I've worked out. It is also used to help on non-union fractures with bony healing in the orthopedic community. There are also light therapies, which had its inception in the early 1900s with two major conditions. The first one being rickets, which was a vitamin D deficiency. And physicians learned quite early that if some of those people were out in the sunlight, they did a lot better. And the psoriasis skin disorder seems to respond very well to UVA light outdoor therapy. And this was discovered in the early 1900s. So we move forward to where we are currently, and some of this light therapy is used to treat certain conditions, such as there is blue light, and you can get that at a dermatologist or a plastic surgeon's office, or there are some home units to treat skin conditions, and namely acne. The 450 nanometers of light that can penetrate the skin actually kills P. acnes, which is the bacteria that is promoting the cystic flares in acne. Now, there is also too much of a good thing when it comes to 450 nanometers of light, because this is what is also emitted in our electronic therapies and light therapies. Light therapies have been used for a long while in the psychiatric community for seasonal affect disorder, to be used either alone or in conjunction with antidepressants. But back to the excessive use of 450 nanometers of light or blue light therapy. This will go to the retina, and the retina will not only talk to the brain, but also the pineal gland. And the pineal gland is what secretes melatonin at night for us to sleep. So if we have too much stimulation with the blue light, that pineal gland is continually activated and does not secrete the melatonin, which is needed for rich restorative sleep. That light will change the serotonin and dopamine amounts of the brain chemicals. So, to that note, after 5 p.m. at night, if I'm on any electronics, I will be using my amber lights to block the 450 blue light that is coming in, such that my pineal gland can secrete its melatonin. I recommend amber lighting to a lot of my attention deficit children who have a hard time shutting down and going to sleep. After 5 p.m. at night, ideally there should be no electronics, but if there are going to be electronics, amber lighting will help with that. There is other light therapies, and laser technology is all around us. Now, laser technology will use certain crystals of various colors. So there are a lot of amethyst-based or alexandrite-based, Or they may be using helium, excitable gases, dye, or semiconductors, but still using the process of absorbing or reflecting light as its treatment therapies. And currently, some of the lasers that we have can actually heal tissue, cut tissue, coagulate, help with skin rejuvenation, and they are typically higher grade, but certainly FDA approved machinery used to take care of a lot of conditions, particularly as it relates to the skin. Green light. This is in its infancy, and it is currently being considered and researched for migraines and pain management. Red light technology is on the market, and that is also to help somewhat block blue light, but also to help with skin issues, stimulate collagen, and help with rejuvenation. So I will quickly show some of the red light therapies that you can get at home, or certainly more aggressively FDA approved ones at a dermatologist or plastic surgeon. So there are some simple things to use at home. Don't forget that too much of a good thing can also be a problem with the human body. So if I were to summarize, I could tell you that energy is around us. We are energetic beings, and we can do some very simple energy techniques to keep our body well. Number one, we could walk outside and ground ourselves and remove ourselves from Wi-Fi, EMF loops, and electronics. Wear the amber lights to help block the blue light from our electronics. Consider calming music, binaural beats, pulsed EMF to help with sleeping. Get some sunlight. Surround yourself with color, and consider singing. Until we meet again, be well